Hello, David. Do you want to explain a little bit more about that, about your research and where this cost of living really stems from?
Yeah, sure. We're getting increasing evidence of the so-called benefits of lockdown and other restrictions. And one of the big frustrations for me as an economist is that the government didn't really investigate whether these things were working, but also what the costs were. And in any sort of policy decision, you need to work out the costs and benefits. And most of the recent evidence now is suggesting that lockdowns probably had little or no impact even on COVID deaths. And most people assume, well, of course, lockdowns worked. Actually, the evidence, you look across the world, so a recent paper suggested perhaps on average there was about a 3% decrease in mortality. Other work from Oxford University suggested there was no impact at all. Yet at the same time, we know that the government spent a huge amount of money telling businesses they couldn't open and paying people not to work. The government estimates about £150 billion were spent in business support. That's not in test and trace or in supporting the NHS. That's in paying businesses not to open and people not to work. That money probably had little or no benefit. Yet, of course, what it did do, it meant that when we opened up, people had a little bit more money to spend. You had supply chain restrictions. So it's not a surprise that we then saw very, very big inflation. And this started long before the Ukraine war, which may have been another factor. But really the driving force is what the government did in lockdown. So we're sort of reaping the consequences now of the decisions that were taken a couple of years ago, which really could have been avoided if the government had taken a harder look at the costs and benefits of what they were doing.
David, just on that, if we'd have not locked down in the UK, but obviously most countries around the world did have some form of lockdowns, would we have avoided these cost of living pressures, or would we still have suffered from them anyway? Because obviously the supply chain issues were impacted by decisions made by governments around the world. The surge in demand would have still happened with other countries around the world when they opened up. So would we have actually avoided this cost of living crisis, or would we have still had it anyway, even if we hadn't locked down?
I think it's either or. I think clearly there would still have been problems, and of course some of the economic hit was because of the COVID pandemic itself. It was real. Lots of people were seriously ill, and we had to take it seriously. And businesses would have been hit by that on its own. As we know from the experience of countries like Sweden, which took a slightly different path, didn't have lockdowns, relied much more on voluntary restrictions, and the same in a country like Japan as well, didn't have worse outcomes in terms of mortality, but didn't see such a bad impact on the economy and in the case of Japan now on inflation. So I think there's some truth. Yes, the government would still have had to spend some money, but certainly not as much, certainly not that £150 billion. And let's remember that's the equivalent of about the whole NHS budget for a year, spent not talking about spending on the NHS, but simply telling people not to work and businesses to shut down. Now, certainly the vast majority of that money would not have to have been spent without the lockdowns and restrictions. And even though we would have still had some problems, as you say, from the international situation, what it would have done is given the government more scope, because having spent all that money, now the government has very limited spending ability to help people out in difficult situations. So they're looking to increase taxes, whereas in a situation like we're facing now, we'd really want the government to cut taxes, to cut energy bills, to help out with that cost of living crisis. But we're finding the government's hands are tied because of the decisions they took.
When you talk about the cost-benefit analysis, I mean, this isn't you talking with hindsight. Lots of people said at the time, you can't just look at one bit of the whole jigsaw puzzle. Politicians are there to look at the health issues, look at the pandemic, but then look at everything else, education and money. And also there was a study by Bristol University earlier on. But what cost-benefit analysis would you have done or wanted them to have done back in 2020?
It's exactly that, looking at the costs. And these weren't a surprise. Of course, you can never know with certainty, but you can certainly know that shutting down schools, for example, will lead to huge costs in terms of education gap. And of course, we know that's going to hit people from poorer backgrounds more than people from richer backgrounds. And that was certainly the case. And there's lots of evidence now. So I think at the time, it was taking a hard-nosed look and saying, OK, we've got this mathematical modelling from SAGE, looking at the health, and we now know that those models were vastly inflated in terms of the number of deaths that they expected lockdowns to save. In fact, we know that infections were dropping before the lockdowns even started. It probably in all three cases of the English lockdown. But irrespective of what you thought of the benefits of lockdown, it was taking into account in your decisions the long-term consequences of following through with those lockdown policies. And it's the £150 billion they spent in support. Well, we knew they would be spending, something like that sort of money. It was the school closures, it was the operations that didn't happen because people were told to stay home. It was the businesses that didn't get business support and still suffered and had to shut down. It was a lot of people's ordinary everyday activities, meeting up with friends for a cup of tea. That's hard to measure in monetary terms, but it's a genuine cost. The kids' parties that were missed. And I think if the government were taking a round view and looking back in history and how we've dealt with pandemics, and the World Health Organization established ways for dealing with pandemics, which they sort of threw out of the window when we went for a lockdown, then at the time, we can understand governments wanting to do something and worrying about how people are, because people, of course, were suffering and people were dying from COVID. But it's government's responsibility to take the long-term view and to say, well, okay, what are the consequences of doing what we're planning to do?